Mercille, thank you so much for this interview here.
Thank you for asking me.
Yeah, I always like to know from our patients what we can do better as an office. How are we doing? And then we always ask, okay, if it's okay with you sharing your story.
Right.
Tell me how from the get-go. How did you?
From the get-go.
From the get-go.
If I can remember correctly, it's been about 1.5 years now, and I had excruciating pain in my lower back, and it radiated a bit. And I knew I needed to have adjustments, and I was going to previous chiropractors, but I was ready for something new. Okay. So I came into Dr. Tam's office, and he gave me the little spiel, and I decided to give him a try.
Right.
And I don't regret it at all. Not at all. The pain that I used to have in my lower back and my going down my legs, it went away within, I think, the first month.
Within the first month?
Yeah, first month. And now I can stand still without, shifting from side to side because of that pain. And it's been wonderful. Right. And just last week, I had some issues with my neck, and that I thought it was my shoulder blade. Right. But you discovered that it was actually in my cervical area. And it's amazing that the pain that you experience in one part of your body is from somewhere else. Right. But you discovered
it's not always from right there.
Right.
A lot of times people ask me, like the moment I find it, they're like, Dr. Tam, how do you know? I said, well, part of it's from experience. Right. The other part of it is as what we do, you have to know some of these things. And that's what kind of problems initially is the lower back.
It was primarily the lower back that I had. I don't remember if there was something else that was really, really bothering me other than that. The things that I normally wanted to do, like just walking or hiking up the water tower here in Vacaville, those things were painful. Yeah. And after just getting on your regime and doing what I needed to do and the exercise that you gave me, it worked.
It worked. Did you remember the before and after x-rays that we looked at?
Oh, yes. I remember that. It's like, who was that old person there versus the new one? It just seemed like one part of my body was up and the other part was down. But the before and after was dramatic.
And have any other offices taken x-rays before, afters, or showed you?
I've only gotten a before x-rays.
Never an after.
I never gotten an after.
Cool. Each year you're here. We'll take an after. Yes. That way we'll be able to see like some of our patients who've been with us for like 9-10 years. I put together like on the screen that we show x-rays. Right. The first time. Right. And then subsequent ones, and we line them up so you're able to see, wow, this is when you first started. Look at how far you've came.
Nice chronological.
And most people, here's the thing. When you talk to most people, your colleagues, your friends, as years go on, they tend to have more problems. Right. That this stops working the right way, that stops working the right way. My goal, and why people ask me, Dr. Tam, why do you take consecutive x-rays to see? I said, well, if a problem is there, I want to be able to catch it right away. Right. I don't want you to wait. Right. Another 5 years. And then because you're 5 years later, problems, they start to show up and health starts to decline. By the time you try to catch it now it's going to take a lot more. I said, I'd rather catch it like right then and there. Right. Let's take care of it.
It's almost like preventative medicine.
It's preventative the right way.
Yes.
The right way. Most people say preventative and it's like, oh yeah, well, take this pill before you need it.
Yeah, no.
Instead of, let's try to keep everything running. It's kind of like a car.
Yes.
You go in, you got your tune-ups, right? You don't just tune it up when there's black smoke coming out in the back. Right. So, very good. Yep. All right. What would you say to other people who are hesitant to try chiropractic or maybe they're like taking a lot of medications and they don't know what to do? Sometimes there's people that are frustrated out there. What would you tell them?
What would I tell them? I think it's easier for me to say it now because I was hesitant to try a chiropractor. Years ago because there was a myth out there that some could twist your neck and break it and you'd be paralyzed. So I was afraid of it. But a coworker of mine who is really, she's really hesitant about doing lots of things. When she recommended going to see a chiropractor, I thought, well, if she sees it, then I will. So I think that people have to be in the right frame of mind and do it.
Right. They have to be ready first.
Exactly. Because I can say it over and over and over again. It's sort of like with Nikki, my daughter. I was telling her that she needed to get some some adjustments that is going to help her hips and her lower back feel better. And she gave it a try. She was ready. She was desperate.
She was ready. Yeah. I remember talking to you about her, and then one day you're like, "Let me just schedule her," and then she came in. Okay, she's ready.
Right. So I mean, like I was saying, you can say anything to a person, but they have to be in the right frame of mind. And what I do is just say it over and over and over again, and then maybe, perhaps, one day it'll click. And they say, okay, I think I'll give your doctor a try.
When they're ready.
Right. You
Mercille,
have to be ready.
Yeah. Thank you so much for this interview. I really appreciate it.